atisarapratishedham व्याख्यास्यामः यथोवाच मुगान्धरमन्त्रिः गुरु अतिस्निग्ध रूक्ष उष्ण द्रव स्थूल अतिशीतलैः विरुद्ध अध्यशन अजीर्णैः असात्मीयश्चापि भोजनैः स्नेहाब्जैः अतियुक्तैश्च मिथ्यायुक्तैः विषात् भयात् शोकात् दुष्टाम्बुमद्य अतिपानात् सात्म्य ऋतुपर्ययात् जल अतिरमणैः वेगविघातैः कृमिदौषधः नृणां भवति अतिसारो लक्षणं तस्य वक्ष्यते. The next is about the atisara, the diarrheal disorders. The causes for the diarrheal disorders mentioned by Sushruta are: one is about the variations in the food, quality of the food, where either it could be indigestible food, where the food contains more of oily substances, or very dry food, or very warm or very liquid food, or the very cold food. Viruddhahara, where there is a toxic effect of the food, or indigestion, or asatmya, where again in patients who are sensitive to the food substances, if you consume the food, or a consumption of snehadikrama like the shodhana preparation, or vishat due to the toxicity, that's one important. Bhayat shokat, psychological abnormalities, psychological stress, either fear or sorrow, or dustambu, that's contamination of the water, consumption of alcoholic preparations in excess, or ritupajayat, seasonal factors, or swimming or getting dipped in water for a long time, or vekavikhatehi, due to suppression of the urges natural, krimidoshavaha, due to these krimis or maybe infective pathologies, the conditions of atisara occur. Now this is a very important issue. The current method of identification of the causes also has on the same line. We make the differences now as I will come to that part, osmotic and the serous type. संशम्य अपां धातुः कुशानं वर्चो मिश्रो मार्तेन प्रणुन्नः वृद्धो अतीव अधः सरत्येष यस्मात् व्याधिं घोरं तन्तु अतिसारं आहुः. The pathology is related to the agni, that's the maybe the digestive capacity, which gets suppressed due to the apudhatu or humid contents of the body, water contents of the body, and when it gets excreted along with the feces and then the water, such condition is called as atisara. So a frequent passage of the loose stools. एकैकशः सर्वसश्चापि दोषैः शोकेन अन्यः षष्ठः आमेन चोक्तः केचित् प्राहुः नैकरूपप्रकारं नैव इत्येवं काशिराजस्तवोचत् दोषावस्वाः तस्य नैकप्रकाराः काले काले व्याधिः तस्य उद्भवन्ति. The types of these would be either depending upon what doshas, vata-pitta kaphaja, or shokaja, that's the psychological stress, and amajanya, that's improper digestion. And according to at that time there was a difference of opinion, like according to some it was considered to be only one type, not the other types, but Sushruta says no, it is all the dosha lakshanas would occur in the course of the diarrheal disorder. Now in the current terminology, diarrhea is acute diarrhea is defined as an abrupt onset of 3 or more loose stools per day. Diarrhea is the reversal of the normal net absorptive status of water and electrolyte absorption to secretion. Now, the definition of diarrhea is of two sorts. One, the definition is based upon the frequency, and that's a particularly acute diarrhea. Acute diarrhea is when the patient has a diarrhea is defined of abrupt onset of 3 or more loose stools per day. The same can be a chronic or persistent diarrhea when it is lasting for 14 days or longer. If the condition persists for 14 days or longer, it is called as a chronic or persistent diarrhea. Another definition of diarrhea is the pathological definition. The pathological definition is where the physiology is altered. The physiology of absorption of water and electrolyte is reversed and it results in secretion. So normally the water and electrolytes are absorbed from the gastrointestinal tract, and instead of getting absorbed, if there is a reverse secretion from the body of water and electrolytes, that's called as a diarrhea. So diarrhea has one clinical definition and the other is a pathological definition. And whatever Sushruta has said about the diarrhea is exactly the same. Like when apam dhatuhu the apam dhatu antak kushanam varcho mishramardena pranunah. That's exactly where the pathological definition is mentioned, like where the normal absorptive phenomena is reversed and it has resulted in secretion of water and electrolytes. Now, more details about the normal water content of the stools is around 10 millimeter per kilogram per day. That's the average in children, and 200 grams per day in teenager or adult. Now, if this is altered, it could be due to pathologies of either the small intestines or that of the large intestine, where either the absorption is affected or there is more of secretion. Now, based upon that pathological changes, the diarrhea is again considered into two categories: osmotic diarrhea and the secretory diarrhea. Osmotic diarrhea is due to presence of hyperosmolar substances in the intestines, which results in the net absorption of water from the body into the intestinal loop, and that is what we call as the osmotic diarrhea. It's usually due to presence of some non-absorbable food substances or non-absorbable substances, whether food or otherwise, in the intestines, and it results in the absorption of water or flow of water from the body into the intestinal lumen, and this persists as long as such a substance is persisting over the intestine, within the loop of the intestines. Once that substance is removed or it has been expelled out, then there will be no more diarrhea. Whereas secretory diarrhea is the other way, where the pathology or physiology of absorption of electrolytes in the cells itself has become abnormal, and it results in active secretion. Instead of absorption, it results in active secretion, either as a result of inflammation or maybe the other pathological factors. Very often it is due to the infections or any inflammation also. Toxic substances also result in the same, and that's called as a secretory diarrhea. A pathological definition of the secretory diarrhea and the infective diarrhea or osmotic diarrhea is in a secretory diarrhea, the electrolyte constituents of the plasma and electrolyte constituents of the fecal material doesn't alter much. Normally, in a normal situation, the osmotic gap or the osmotic substances present in the plasma and in the fecal material are nearly same, almost same as such, and it's around 290 to 300 milliosmolarity per kilogram body weight. Now, in case of the secretory diarrhea, the gap between the two, difference between the two is not more than 50, and that gap is defined as by a formula of 290 milliosmolarity per kilogram minus 2 into the sodium concentration in the stool plus potassium concentration in the stools. So that's how it is calculated. That's a standard formula, and when this formula is less than 50, then it's called as a secretory diarrhea. When it is more than 125, it's called as osmotic diarrhea. So from the clinical point of view, this is important. In osmotic diarrhea, there is some substrate in the intestine which results in the reabsorption of water, and that needs to be expelled out. Secretory diarrhea, there is some abnormality in the mucosal physiology which needs to be corrected. Of course, 50 to 125 is considered as indeterminate. Now, this factor can be assessed if you have a laboratory assessment of the osmotic gap, but the other way, clinically also it can be made out. In general, secretory diarrhea would be having very thick consistency, comparatively thick consistency, whereas osmotic diarrhea would have more thinner consistency. Now, diarrhea is one of the major issues, particularly in the pediatric practice, and World Health Organization has considered this as one of the important diseases which need to be tackled and easily tackled and can be prevented. And there is a major program about dealing with the diarrhea. Some standard guidelines also are there, which are dictated by the WHO. And the key facts as such, I have just copied the key facts from the WHO document about the diarrhea. Diarrheal disease is the second leading cause of death in children under 5 years of old, and it is both preventable and treatable. Each year, diarrhea kills around 5,25,000 children under 5. A significant proportion of the diarrheal disease can be prevented through safe drinking water and adequate sanitation and hygiene. This is one of the important issues. Diarrhea is preventable. Globally, there are nearly 1.7 billion cases of childhood diarrheal diseases every year. The incidence is very frequent, and it's a leading cause of malnutrition in children under 5 years of old. Anyway, that's about the issue. Then, as far as the clinical presentation of atisara is concerned, हृन्नाभि पायूदर कुक्षितोद गात्रावसाद अनिल सन्निरोधाः विट्संगः आध्मानम् अथ अविपाकः भविष्यतस्तस्य पुरस्सराणि. Before the atisara occurs, the patient would have a discomfort or pain in the abdomen and even anal area, or throughout the body there could be pain or maybe some reduced activity, and anila sannidhoda, constipation could occur, or obstipation also can occur. Distension of the abdomen and improper digestion are the purvarupa, the prodromal symptoms of a possible atisara. In case of vataja atisara, shulabhishtah, saktamutro antrakuji, sastrapanah, sannakati, urujangah, varcho munchati, alpam sapenam, ruksham, shavam, sanilam, martena. Now, in case of vataja variety of the atisara, the patient would have more pain. Patient also may have a reduced fluid, urine output, and there could be antrakuja, that's the barbarigmi, loud sounds produced in intestines. The more important is there would be pain or burning sensation in the anal area, the perianal inflammation, the proctitis, srastra apanaha, proctitis symptoms would occur. Even there could be pain in the whole pelvic girdle, sannakati, urujangaha, in the pelvic girdle area there could be pain. And when the patient passes stools, it will be small quantities of the whole stools with the foamy contents or dry contents or bluish or maybe a blackish content, and there would be flatus also. Now, these kinds of the features are characteristic in case of chronic ulcerative colitis. Now, as far as the common clinical conditions presented with the diarrheal presentations are mainly, we categorize them into three categories. Mainly, the most important conditions are ulcerative colitis, bacillary, and protozoal or amoebic colitis. Ulcerative colitis is an autoimmune disorder where there would be proctitis resulting in ulcerations in the colon, and there could be very chronic condition which tends to occur repeatedly, and there could be a sensitivity to the food also, and debilitating illness where systemic features also would occur quite frequently. And it's a very chronic condition which persists for a long duration with the exacerbations repeatedly, and hence that almost resembles the clinical features of that of the vataja atisara lakshanas. Then in case of pittaja atisara, durgandhi ushnam vegavan mamsatoya prakhyam bhinnam svinna deho atitikshnam pittar pitam neelam alohitam va trishna murcha dahvaka jvarartha. In case of the pittaja atisara, the flatus, the stools would be foul smelling and warm, hot also, and the frequency could be quite high, and there could be watery or maybe fleshy containing discharges, fecal material. Mamsatoya is soup like. Bhinnam sinadeha, and the patient may have the general signs of dehydration, though throughout there could be sweating, or even the patient may have excess of thirst, murcha, daha, unconsciousness, burning sensation, and jara. Body temperature would be higher. Contents could be either bluish or maybe reddish or blood stained and so on. Now, this is typically in case of bacillary dysentery. Bacillary dysentery is characterized by a short course, acute onset, short course, and the frequency will be very high. In general, the frequency will be more than 20 per day in a typical bacillary dysentery, and the stools tend to be watery, hemorrhagens, or even there could be less of mucus. Patient may pass stools alone, patient may pass only these diarrhea, watery stools, watery substances only. The stool material may be absent. Dehydration signs and systemic signs of toxicity could be quite frequent and quite high also. Then in case of the kaphaja atisara, tandra, nidra, gaurava, utkleshasadi, vega, shanki, sasabitkopi bhuyah, shuklam, sandram, shleshma yuktam, bhakta dveshi nisvanam susroma. The patient of kapha atisara would have a reduced activity, physical activity, tends to feeling sleepy, heaviness in the body, and there could be utklesha, salivation, and the patient would have more frequent griping pain in the abdomen. Even after the griping pain, patient passes the stools, still there could be a strangling feeling of going for defecation further. Griping pain is quite frequent, and the patient would always suspect that he is going to have a passage of the stools, but either he doesn't pass the stools or maybe very small quantity is passed, and more of mucus substances, mucus substance would be presented or discharged as such, and the appetite would be reduced. This is very typical of the protozoal, particularly amoebic colitis. Amoebic colitis is characterized by presence of stools. Frequency can be comparatively lesser compared to bacillary. Systemic toxic signs also are lesser. Usually the frequency will be less than 20 in protozoal, whereas in bacillary the frequency is more than 20. It tends to be bacillary protozoal this colitis tends to be more chronic, and the patient would have more of mucus, and every time the patient passes there would be some amount of stool material plus there would be some amount of the mucus, unlike that of the bacillary where the patient may pass only the mucus and or watery contents. Then in case of the Vishajanya or Tridoshya, तंदायुक्तो मोह सार्ध आस्यशोषी वर्चक कुर्यानिक वर्णम त्रिशार्तः सर्वोद्भूते सर्वलिंगोपपत्तिः कृच्छश्चायं वृद्धेशोसाद्यः. Tridosha, there would be more of systemic symptoms, like patient would have a reduced the consciousness, or even there could be unconsciousness, and shoshi, the patient would be looking dry, and stools may have any variety of color. There would be excess of thirst also, which is either a sign of very severe dehydration, or the same also can occur in case of the toxic colitis. Toxic colitis, like when some toxic substances are consumed and that produces the colitis. Then the तैः भावे शोचतो अल्पाशनस्य बाष्पावेगः पक्तिम् आविध्य जन्तोः कोष्ठं गत्वा क्षोभयत्यस्य रक्तं तच्च अधस्तात् काकणन्दी प्रकाशं वर्चो मिश्रं निपुरीशं सगन्धं निर्गन्धं वा सार्यते तेन कृत्स्यात् शोकोत्पन्नो दृष्टिकित्स्यो अतिमात्रं रोगो वैद्यः कश्च एष प्रतिष्ठः. The diarrhea or atisara produced due to psychological abnormalities like either excess of sorrow or excess of fear. The patient would have digestion properly, but the patient would have discomfort in the abdomen, and then the patient may even have passage of hemorrhaginous stools, and many times the patient may pass the stools with the blood and no stools at all at times. Either there could be no smell or maybe some amount of abnormal smell, and this is considered the stress induced. Now of course we do use a word called as spurious diarrhea. In the spurious diarrhea, it's now we consider this as a clinical sign of a mass in the rectum, maybe one of the possibility. It also can occur in case of the psychological abnormalities. Spurious diarrhea is now defined as a situation where the patient would have a incomplete sense of defecation. Every time the patient passes the stools, he will not have a passage of the stools, and then there would be occasional diarrhea and then constipation. Patient would not pass the stools for a few days, and then there would be this diarrhea, which is again now we consider this as one of the possible signs of a tumor in the rectum area. Or a similar situation also can occur in case of what we call as irritable bowel syndrome. Now maybe the other term used is irritable bowel syndrome, which is exactly the same as that of the Shokaja or Bhaja Atisara. So Shokaja or Bhaja Atisara is irritable bowel syndrome, or the spurious diarrhea also could be considered as one of the other options. आमाजीर्ण उपद्रुतः क्षोभयन्तः कोष्ठं दोषाः संप्रदुष्टाः सभक्तं नानावर्णं नैकशारयन्ति कृच्छार्जन्तो षष्ठमेनं वदन्ति. Ama atisara is where the patient would have ajirna, improper digestion, and as a result of that the patient may pass the stools as they based upon the contents. That's typical of the osmotic diarrhea. Osmotic diarrhea where there is some undigestible food substances, or maybe something which is present in the colon, like medicines, or it could be the soil-like substances, pectin-like substances may be presented over there, and that can produce the diarrhea. संस्रस्तं येभिः दोषैस्तु न्यस्तम् अप्सु अवसीदति पुरीशं वृषदुर्गन्धि विच्छिन्नं च आमसंज्ञकम्. Whether it's a amatisara or the other way, it can be made out by the examination of the stools. If the stools get dipped in water, when the specific gravity of that stool is more, then it is considered as amatisara. Whereas when it has become pakwa, or when it has become fully digested, then it will float on water and there will be lightness, feeling of lightness in case of pakwatisara. यथान्यामहितलिङ्गानि विपरीतानि यस्य तु लाघवं वा मनुष्यस्य तस्य पक्वं विनिर्चेत. Now, as far as this stool examination in water, like whether it dips or not, is still valid. It suggests the specific gravity, but now we have more accurate method of confirming whether the stools have undigested particle or not by maybe either biochemical test, specific biochemical test for the fat contents in the stools, or even microscopic examination also can show the substances. Like biochemical analysis of the stools can give you more specific information about which type of the food is not really absorbed, either whether it is a carbohydrates or whether it is a fat or such conditions. The more clinically more significant would be the steatorrhea, where the fat is not absorbed properly. That's how it can be measured. So you may now have more details of making more detailed method of identifying whether it is a amatisara or a pakwatisara. सर्पिर्मेदो वेशभाराम्बुतैल मज्जाक्षीरक्षौररूपं स्रवेद्यत् मञ्जिष्ठाभं मस्तुलुङ्गोपं वा विश्रं शीतं प्रेतगन्धी अञ्जनाभं राजीमद्वा चन्द्रकैः सन्ततं वा पूयप्रख्यं कर्दमाभं यथोष्णं हन्यादेतद् यत् प्रदीपं भवेत्यक्षीणं हन्यश्च उपसर्गाः भूताः असंवृतगुदं क्षीणं दुराध्यातम् उपद्रुतं गुदे पक्वे गतोष्माणम् अतिसारकिणं त्यजेत. Now either upasargaja or infective conditions where the stools may have any of the appearances like either ghee or like fat like substances or appearance, or maybe like watery, or maybe taila oily, or majja like or kshira like, any the appearance may take the example or may simulate any of the other food substances, or it could be like manjishtabam, hemorrhaginous, or mastulungopam, thick brainy substances are also maybe there. So and it may have a very foul smell. Pretagandhi is a very foul smell or blackish color as such, or there could be some lines of different colors. Chandraka is that lines of different colors, or even purulent. So consistency and appearance of the stools will be quite varying. And moreover, there could be asamrita gudam, the abnormality related to the tone of the rectum area. Patient may have even incontinence as such, or gudapaka, proctitis, severe proctitis. Such conditions are considered as asadhya. Either it is due to the infective as well as it is a sign of asadhya. शरीरिणाम् अतिसार सम्भूतो येन केचित् दोषाणमेव लिङ्गानि कदा नापि वर्तते. स्नेहाजीर्णनिमित्तस्तु बहुशूलप्रवाहिकः, विशूचिकानिमित्तस्तु यो अन्यो अजीर्णनिमित्तकः, विष अर्ष कृमिसम्भूतो यथास्त्वं दोषलक्षणः. Now, whatever may be the type of atisara, Sushruta says you have to follow the dosha lakshanas, and based upon the dosha lakshana, the protocol of the treatment has to be followed. If the atisara is produced to sneha jirna, consumption of sneha dravya, and ajirna has occurred, then there would be more pain, and it may you have to go for a remedy for that sneha. Or Vishuchika is one of the specific disease entity which is a complication of atisara, which is produced with the ajirna. There again you have to treat that ajirna primarily, and in case of krimija atisara or vishaja atisara or arshas induced atisara, the treatment has to be followed the dosha lakshanas. In the current practice, any diarrheal disease has to be categorized mainly under two categories, depending upon the source or the origin where the diarrhea has occurred. Either it could be small bowel or large bowel. A typically small bowel induced diarrhea would be watery, and large bowel mucoid and bloody. Volume, in case of small bowel induced condition, it will be very large quantities. Every time the patient passes the stool, so the quantity would be more. Whereas in large bowel, the quantity would be small, but frequency will be very high as such. In small bowel, the frequency will be moderately raised as such. Then blood may be possibly positive, but the color of the blood would be altered. It will be either blackish or brownish, coffee ground colored, or maybe even tar-like, melina, tar-like in case of the bleeding from the small intestines. Whereas if the bleeding occurs from the colon, large bowel, then the appearance of the color of the blood would be very close to the normal. There could be either bright red color if it is from the distal parts, maybe slightly brownish color if it is from the proximal part of the colon. pH usually in case of small bowel pathology, it will be less than 5, that's it will be always acidic. Whereas in the large bowel, it will be more than 5, tends to be towards the alkaline side, not alkaline, but tending towards the alkaline side. Then if you study the biochemical analysis, reducing substances are commonly positive in case of the small intestinal pathology, whereas large intestinal pathology they are negative because they are already absorbed. WBCs in case of infective pathology also, in case of the fecal small intestinal pathology, WBCs would be lesser than that of the large intestinal pathology. Serum concentrations usually in small intestinal pathology are not affected, whereas the WBC count tends to be raised in case of large bowel pathology. The type of the organisms which can produce the infections like bacteria in small bowel is usually Salmonella or E. coli. In our conditions, Salmonella and E. coli are more common. Vibrio cholerae is a cholera-inducing organism which can occur as a very severe epidemic condition. So from our current point of view, mainly these three are the important. Other Staphylococcus or Aeromonas or Bacillus also are not such important in case of a small bowel pathology. Colonic pathology is mainly Shigella, which is more common in our condition, and Clostridium also, which is quite common. Klebsiella also is quite common in our condition. Then viruses, rotavirus is very common in children in our area, and in the colon it is a cytomegalovirus or adenovirus which is more common. Herpes simplex virus also can produce the diarrhea in the colon occasionally. Protozoas, among the protozoa, it's Entamoeba histolytica, which is a more important one in our situation. And Entamoeba, Giardia is the next in colon pathology, whereas in the small intestine, it's a Giardia which is the more common. That's about the type of the organisms. And the source of organisms are now related to the food, and the common relationship with the food and the source of type of the organism are daily food like milk and milk factors. When they produce the contamination, most of the times it is Campylobacter or Salmonella. Eggs, Salmonella species. Meat is a Campylobacter, Pepharinges or Aromas or Salmonella species. The beef, enterohemorrhagic E. coli. Poultry, again Campylobacter species commonly. Pork, Campylobacter perfringens or enterocolitica. Seafood, the fish and so on, astrovirus, and oysters, calicivirus, and vegetables, aromanas. Now these are all important if you manage the patients with the antibiotics. But when we say Ayurvedic management, these do not make much difference whether it is any specific species of organism or not. Now as far as the principles of the treatment are concerned, one of the basic principles according to Shushura is आमवक्को क्रमं हित्वा नातिसारे क्रियाहितः अतः सर्वे अतिसारास्तु ज्ञेयाः पक्वामलक्षणैः. The basic approach to the treatment of atisara would be to decide whether the atisara has amalakshana or pakkalakshana. If it is amatisara, then you have to ensure that the diarrhea is not suppressed, atisara is not suppressed, and you have to ensure that the process of digestion improves. Pakvatisara, a suppression or some anti-diarrheal drugs could be used. तत्र आदौ लङ्घनं करणीयम् अतिसारेषु देहिनं तथा पाचनसंयुक्तो यवाग्वादिक्रमोहितः. In all cases of the atisara, the primary treatment is Randhana, and then the Pachana, Deepana Pachana has to be given. Karyam Vamanasya Ante Pradrovam Lagubhojanam Khanda Yusha Evagushu Vipalyadin Yojet. Vamana can be indicated in certain of the conditions, and the Vamana also can be given after light food, or you may also have to give Pipal Yavagu. Anena Vidina Chamam Yestia Upasham Esevi Nopashamyadi Haridradi Machadima with Pratastamana with the Langhana and the, if possible, Vamana. The Amatisara is not cured. In such conditions, you may give more Deepanapachana like Haridradigana Machadigana yogas. Amatisarinam Karyam Nado Sangrahanam Nudam Desham Doshaha Vibuddaha Prak Jane Amayan Imana Priha Pandu Amayan Amaya Pandu Amaya Anaha Meha Kusta Udara Juran Shopu Gulma Grahani Arshaha Shula Alasaka Grahana. In all cases of Amatisara, the suppression of the urges should not be done, or what we call as anti-diarrheal drugs should not be given, because if they are administered, it can produce complications later, like involvement of the pliha, or there could be pandvamaya, or the meha kusta udara, etc. Ye atidravam prabhutam ja purisham atisarite tasya adav vamanam kuryata paschat langana pachanam. If the patient has a very severe watery diarrhea, Sushruta recommends vamana treatment in that patient, and then the Langana and Pachana has to be done. Now, the issue is a bit controversial, like when a patient of diarrhea presents with the severe frequencies, whether Vamana can be really get done or not is a real question, like, so you may have some difference of opinion. Then, Sokam Vibadva Sashulamma Yatisarite Abhaya Pipali Kalki his question tam virajayata. If the patient passes the stools in small quantities, or there is again harder material in the stools with pain, in such conditions, Abhaya Pipali can be given for the Virechana. A Virechana also could be recommended in a case of Atisara. Again controversial. Ameja Langaram Shastam Ado Pachana. In case of Amatisara, the initial approach would be Langana and then the Pachana. Now, in all cases of diarrheal disorders, the most important part now from the current point of view is to ensure that the dehydration is prevented as well as the dehydration is corrected. And the most critical aspect in case of any diarrheal disorder is the dehydration. And assessment of the dehydration is mainly based upon the clinical assessment, and the clinical assessment would be by identifying the features in the eyes, tears, mouth, thirst, skin, etc. The typical would be in a patient of moderate or no dehydration, the general condition would be well, patient would be active. A moderate dehydration where it between 5 to 10%, then its restlessness can be seen. When the dehydration is more than 10%, patient will be lethargic. In a severe dehydration, more than 10%, eyes would be sunken, tears they tend to be reduced or absent, then mouth becomes very dry, and the thirsty patient may have excess of thirst, but patient would not be able to drink water. In such conditions where the dehydration is more. Moderate dehydration makes the patient thirsty. Skin pinches and if you pinch the skin, it stays folded in case of severe dehydration, and the skin pinching test is one of the important issue. The other way of assessing this dehydration will be either by degree of body weight loss, or assessment of the osmolarity of the blood, or sodium level. These are the other criteria by which the severity of dehydration is assessed, and the management of the dehydration is done accordingly. If the patient has lost less than 5% of the body weight, then it's a mild one. 5 to 10% of the body weight loss after the diarrhea is moderate. If more than 10% of the body weight is lost, then it's severe. Osmolarity is again based upon the osmolarity of the blood, and where we categorize is as a isotonic, hypotonic or hypertonic. And the sodium also, sodium isonatremic is where the sodium level is normal, and hyperosmolar the sodium level will be more. So that's one of the important protocol. Now, instead of Langana, I would say prevention and correction of the dehydration is the first and most important management of the Atisara or diarrheal disorders. Once you do that, majority of the conditions can be managed without any other further intervention, but in some of the conditions we may require the intervention, which I will come to in due course of time as we go further into the discussion. The treatment, the drugs and the yogas mentioned by Sushruta in the Atisara are the continuation. Because of some commitment, I will be winding up today a bit early. We will continue with this in the next session. If there are any questions, we will try to answer and then wind. So there is some question like, can we correlate osmotic and secretoria with the nirama and ama? Not so. I would say secretory conditions are primarily ama conditions. As far as the osmotic, it may be nirama or ama, depending upon the presentation. So ama and nirama would be based upon whether the patient is able to absorb the substances or not. And majority of the infective pathologies, secretory conditions, they are ama, because the absorption is not proper. So that's how we have to consider. Anyway, right. So we will continue in the next session maybe.